I want to roll up our sleeves a little bit and delve into two things. One is collaboration, and the second is evaluation. And I think we've talked around these concepts a lot today. These are really kind of underlying our not undermining, really underlying our entire RFP, right? These are our grant-making philosophies. And they, hopefully they don't undermine us, because when you do evaluation, it's possible that you might find that your programs weren't working as well as you thought they were. But we're going to get into that a little bit. So, when we first came up with behavioral health, great, we've arrived at our focus. We know what we're going to focus on. That's just the beginning, right? We still need to figure out what our approach is, how we're going to fund it. And so we kind of had this approach of using problem-based learning. Is anyone familiar with problem-based learning? It's basically asking these questions: what do we know already? What do we need to know? And how are we going to find out that information? And so when we look back at all of these, Katie was reviewing our community health needs assessment and our listening tours and our environmental scan. What do we know already? We know there's high rates of mental illness and substance abuse. You heard Ron and Katie talk about 18% versus 13% in California. That was really surprising to us. Even though we heard a lot in our listening tour about the problems, you saw it right there in the data. And then for alcohol, we're also a little bit higher for binge drinking when compared to California. We know there's access barriers. We know that people have a hard time seeing a psychologist. We know there's long wait times. We know there's financing barriers and funding barriers. We know that it's hard for psychologists to move to the area because of cost of living, being workforce barriers. And we know that high quality services exist, but sometimes it's the funders that are in the way, really, of making those high quality services get to the community who needs them the most. There's a lot of experts in this room, so I was actually going to put it to you all. What else do we know about the problem of behavioral health needs in Santa Barbara County? Can we get a mic? Language barriers, cultural barriers. Luann, you were going to say the same thing? Same thing. Okay. That's huge. Medications.
Yeah, having prescribing physicians.
Having prescribing physicians, exactly.
And medically assisted treatment.
Right. Maybe you can see an MFT, but what you really need is a psychiatrist. Yep.
Crisis facilities.
Crisis facilities. Lack of crisis facilities. Yeah. What else? Yep.
Often knowing that the problem, a parent knowing that the problem they're dealing with actually falls under mental health as opposed to,
Right, so being able to correctly know if this is identify, is this a mental health issue or is this a developmental issue? I mean, is this just a stage that my child is going through? That's great, yeah. Yes?
The stigma involved.
Stigma, huge. And you heard that come up for us as well. These are great. So what do we know? We know a lot, but we still need to know a lot as well. What do we need to know? We need to know specifically which populations are suffering, where, what services are being provided, and maybe where are there gaps? What are the most promising solutions, and how can we align our efforts? These are some of the questions that we have from Cottage Health about what do we need to know about behavioral health. And then again, I would put this back to you. What haven't we asked here? What are some questions that you might have about behavioral health needs in Santa Barbara County? Yeah, in the back.
The families of the people with the issues also need support.
Okay, families of the people who have issues that need support, and what about them exactly?
They need all this too.
Yes. Okay, so providing care to the family. Got it. And what are their needs? Okay. What else?
What about our people who are suffering being put on medication or kept on medication that they should not be on
Okay.
or they get off of?
Mm-hmm.
And also
let me rephrase that one so the room can hear. So are people who are suffering actually being put on medication that they maybe shouldn't be on, that may actually be contributing to the problem? And then the second part.
And then, the issue with people who are, may have mental health issues and not actually taking the medicine if it is prescribed.
Interesting. So people who have mental health issues not taking their medications as prescribed, some compliance and adherence issues. Yep, in the back there.
Thinking about environmental and cultural issues that are contributing to mental health issues. I'm thinking about LGBT youth not being accepted in schools or bullying and that kind of thing. How much can we do as a community to address the underlying issue that's causing these problems?
Okay, so cultural issues, specifically thinking about LGBT youth, these are kind of community level issues. So what do we do as maybe an organization or even a coalition? How are we addressing these community level issues? And then I saw here, and then you, yep.
I'm thinking systems change, especially around our medical health population and the women group. It feels that there's a lack of information about how that process works.
Okay.
There needs to be more transparency around that.
Okay. So the comment was systems change specifically around our Medi-Cal population and their access to care provided by the Holman Group. Clearly some gaps there and some need for systems level change. These are great. I had one other. Yep.
So it really has to do with co-occurring disorders and a bifurcated system. That so many services are bifurcated and you have individuals that are co-occurring. And they might be having their substance use dealt with, but they're not getting mental health services until substance use is masking.
Great. These are questions we had as well. So the comment was co-occurring disorders, so substance use disorders and mental health issues, and is one perhaps masking the other
And a bifurcated system.
in this bifurcated system that only serves either substance abuse or mental health. Yep.
So who else needs to be at the table, like law
great.
enforcement and school officials that have other things that they're worried about? How do we engage them with people with mental health illness, and how do we keep everyone safe?
This is great. So who else needs to be at the table? Not just mental health providers, but law enforcement, education. These people are part of the network of service providers, these organizations, and how can we bring them to the table?
Is there someone here from County Behavioral Wellness?
There was earlier. Is anyone here from County Behavioral Wellness?
Just walked out.
I think she just left, yeah.
Are we looking at how this integrates into the long-term system of care methodology that the county is trying to develop?
Okay, so the question is, are we looking into the long-term system of care that County Behavioral Wellness is trying to develop? Yes. So I think the question is for me, right?
Yeah.
Okay, so I think you heard Katie talk a little bit earlier about the Behavioral Health Collaborative, which is this idea to try and pull the health organizations together in the county, see where our shared priority areas were, and behavioral health, without a doubt, rose to the top. We came together sort of not knowing what the shared priority areas would be, and behavioral health emerged. And so that is currently our attempt. Cottage is convening the group, but we don't plan on sort of leading the effort necessarily for years to come. This needs to be a collaborative effort. Right now, I'll be talking about it a little bit later, but right now we have just had our second meeting, and we're collecting data and trying to better understand the problem. So.
I can follow up.
Sure.
With that framework in mind,
Yep.
it shows me this one-year project. There's great emphasis and support. But I'm concerned about building some short-term capacity that we can sustain.
Okay, so the concern is it's a one-year project that's building short-term capacity. How are we going to sustain that? It's a valid concern, and that's why we are building into our RFP process the emphasis on sustainability and trying to. One of our biggest fears is that we would fund a project that then doesn't have a sustainability plan and it goes away, and we've provided services that we now have to take away from individuals. So that's not something we want to be doing. And Amma, you have a comment?
And I'll just add to, though the grant is a 1 year or 15 months, that doesn't mean that our focus or the fact that behavioral health is a priority will change. So I definitely want to ease some of the concerns around that as well. I think, yes.
Yes.
I have a comment on this too.
Okay, thanks, Alma. Yep, one comment.
I think one other thing that we need to know is how our county policymakers feel about what's going on, and do they know the landscape of behavioral health?
That's great.
And who's going to hold them accountable once they do know?
Great questions. So the question was, how are our policymakers, our county policymakers, viewing the landscape of public health, and who is actually holding them accountable to what we're learning here as far as behavioral health needs and gaps? I'm going to move on, but this is a great conversation. We are capturing every single word that everyone is saying in the room today, and we look forward to sharing the findings with everyone. So what do we know? What do we need to know? And then the third question, how will we find out? This RFP application process is obviously, for us, this is a continuation of our environmental scan. It's a continuation of us learning from the community about what's actually happening. We would love to fund every single applicant. We know we won't be able to, but we consider this RFP the first step, or a continuing step in building our relationships so that we can better understand your capacity and start to strengthen organizations and strengthen our own organization and our understanding of behavioral health in the county. Our grantees will form a learning community. We look forward to sharing the learning from our learning community on our website. In various ways, we will be sharing what we're learning with the entire community. We talked about the Behavioral Health Collaborative already. Ongoing listening tours. So when we did our listening tour last fall, that was kind of our formal listening tour. But what we've done since then is Katie, Ron, Monica, Amma, and I have gone out and met with dozens of organizations, and we consider this our informal listening tour. We're listening. Our ears are open, and we're continuing to just learn so much as we go. We're going deeper into this issue. And then lastly, and this segues into my favorite topic, evaluation, tracking our progress. And so what we need to know is what we're doing working? Or is it not working? And we're shifting kind of our focus from evaluation for proving something to evaluation for improving. We are very, very focused on improvement. And I'll talk about that a little bit later. So this kind of sums it up perfectly. Right? We might be, doing the best possible strategy in this war against homelessness. But if we don't stop and look at the results, are we actually winning this war? And I don't think this is something that just our community is struggling with. I think this is something that communities all over the country are struggling with. So now we're going to have some fun. I would like you to turn to your person sitting next to you. You can do this in groups of 2 or 3. And share with each other what has been your best or worst experience with evaluation. And when we say evaluation, I'm talking about program evaluation, not necessarily performance evaluation, because I'm sure we've all had lovely experiences with those. Please try and focus on sort of program evaluation, the evaluations that you all are part of through your work. Ready, go. If we have any brave souls willing to volunteer, we'd love to hear some examples of your best or worst evaluation experience, if you could please share. Brave souls? Yes, it is. I see Chuck. Thank you, Chuck.
Yeah, so I've been both an evaluator and evaluated. And the best experience was when we had a really high-powered consultant come in and use the evaluation of a program to really look closely at the whole organization and what we were really about. And it had profound implications from top to bottom of that organization. So that was really positive.
That's awesome.
So evaluation is an opportunity to take a hard look at what you're about.
Yeah.
The worst case was I was evaluating an organization that was receiving funding that did no intake forms, no client tracking, no case notes. Yeah. And I was put in an awkward position of saying, I have to recommend that your funding get pulled. So it's important.
Right.
I guess my philosophy is if you don't write it down and there isn't a record of that data, then it didn't matter.
If you don't count it, it doesn't count. Whew. Yeah. So let's talk about your first one. Because using evaluation, you can have the best program and the best program staff who are so committed to evaluation. And then if that evaluation and those results aren't taken up by the organization, it just doesn't have the impact. It doesn't go as far. You can't learn as much, and you're not kind of changing the culture of the organization to be one that really is evaluatively minded. So I love that example about the entire organization actually changing their culture and embracing this concept of evaluation. Okay, so anyone else? Best or worst? I heard y'all talking. Yes.
Family Service Agency has moved to online reporting in the last couple of years, and it's made reporting a lot more easy.
Mm-hmm. That's a great one. I mean, that is just so succinct, right? The second you automate or systematize any data collection system, your life gets so much easier, and then you have access to those data. That's a great one. All right, yes, Luann.
If it's the
Oh,
right-
wait, get the mic. Sorry.
Just to chime in on what my colleague has said, it has to be it should be right.
That's not right. Yeah. I'll repeat it.
So we worked with two different evaluation data systems, and the first one didn't work, and the second one is working. So it needs to be the right one.
Okay, interesting. So she said they work with two different evaluation systems. The first one didn't work and the second one did, and it needs to be the right one. I think that's so true. We can invest so much in these systems and then find out, oh, crud, this isn't going to work at all. And we can talk more about that. Yes?
I would say worse is translating your data to community members and funders that's understandable and accessible.
Ooh, good one. So do you have an experience doing that, having tried to do that?
Yes, and I didn't do a very good job.
Okay, so the comment...
The community, so if you're doing your annual report and you're translating it in Spanish, that it has to be, just appropriate to the population,
Yeah.
the literacy level.
Literacy.
But still include some valuable information.
Mhm.
So, you have to look at your audience to make sure that you're communicating it in a way that it's accessible.
Yep. So for those in the back, the comment was translating your evaluation results to the community, so in a way that they can actually understand it, whether that's literally translating it into a different language or sort of translating the concepts into a language that is understandable by the community who might not be as familiar with the terminology in your program. Did I capture that? Okay, great. Let's take one more. Anyone dying to share your story? Okay, we're good. Let's move on. So I just wanted to acknowledge that there are some very real barriers to doing evaluation. It's going to make me look bad. They might defund my program, right? I don't have the time, I don't have the resources, I don't know where to start. And I don't know how to measure this. Humans are messy and complex, and we'll get to that in a second. How am I supposed to measure outcomes from a program that's serving youth, for example? So we are very, very aware of these barriers, and I think what Cottage Health leadership is really trying to impart is our evaluation philosophy, again, is really focused on improving rather than proving. We are not trying to use evaluation in a punitive way. And I know it's going to probably take a couple years before you trust us. But because we're coming out with this approach to evaluation. Evaluation is this big, bad, scary word. And we're actually trying to make it soft and fuzzy. And that's a little weird, right? That's not the typical sort of experience that people have with evaluation. But I did want to say the power of evaluation is really in kind of you're feeling confident that you actually know what's going on in your program. And if we don't evaluate, we do have there's a possibility that we are causing harm and we don't know it. And I just wanted to share a story with you. I read an article a couple years ago on philanthropy.com that stuck with me ever since, and I use this example. There was a sort of a family service organization, I won't call them out, but you can go look them up online, in DC. They were offering parenting classes. And as part of the parenting classes, they had added a domestic violence prevention session, a couple new sessions. They said, oh, we should do this, based on kind of what they were seeing. And they were very evaluatively minded, had set up great evaluation, and they evaluated the program, and they found that their program had actually contributed to increased rates of domestic violence amongst their program participants. And they never would have known that, right, had they not evaluated it. But amazing, kudos to them for actually sharing that story with the world, right? Because they took it on, They made some changes. They separated the men and the women in the classes. They made some other changes, and they continued to evaluate it, and it turned it around completely. But that's just an example of if you're not, we don't know, if we're not evaluating our programs, we actually don't know. We could be causing harm. And so, if I haven't scared you enough with that example, I did want to move on to reminding you that evaluation, again, it's just answering questions that you have about your program. How do you answer those questions? You use a framework, you use a toolkit like the one that Alma just described. And it really ensures that you're helping collect data that are meaningful to you. So if your evaluation is just for the funder, right? And I know that a lot of evaluations are that way and you just kind of have to do it. But if your evaluation is solely for the funder and it's not answering questions that are important to you, I would be wary of the data that are in that evaluation, right? Because you're not as connected to the importance of those data. And again, a little story. I was working for a medical school in Atlanta and doing an assessment to help them figure out if they needed a data warehouse. And doing some interviews with top leadership and working with one woman and asked her, okay, so are you responsible for any evaluation reports to the president of the college? She said, oh, yes, and she showed me her beautiful dashboard, right? It has red and green and yellow, all these indicators, really nice dashboard. I said, great, where do you get these data? And she says, I make them up. Literally, she makes them up. And I was just, I had to be neutral and I had to, pretend like, okay, no problem. Oh my God, she makes up her data. This is unbelievable, right? But then when you think about it, it's not unbelievable because she's not answering questions that she has about her program. Yeah. She's answering somebody else's questions. So of course she's making up the data, right? So what we're trying to do with this evaluation toolkit is help you answer questions that you have about your program and then train your funders, right? Tell us what are the most important questions that you should be asking about, that we should be asking about your programs. So these are the questions that we're asking about behavioral health. You heard Alma talk about our initiative level outcomes a little bit, and actually you have this behavioral health framework, yes, on your table. This is kind of our theory of change. In other words, it's our theory of how we think those initiative level outcomes will be achieved. And we felt it was important for applicants to know the underlying theory of change, not the undermining theory of change, in our work. And just a quick note, this will always be a work in progress. Our grantees will continue to help us develop this theory of change over time. This is where we're starting from right now, our current kind of understanding of the landscape, if you will. So starting on the left, we heard over and over again in the listening tour, and we saw it again in the data, that collaboration is desperately needed. And so we're starting with the expectation of collaboration. And then we split it into two different kinds of strategies that you've heard us talk about already. The first is focused on those policy systems and environmental changes that need to happen to create access to care and a healthier environment for all residents of Santa Barbara County. So this is kind of that upstream approach, attempting to put in place those things that would prevent behavioral health issues from occurring in the first place. We know that not all behavioral health issues are preventable, but many of them are. And so we are very focused on addressing some of those barriers that we saw in the earlier slide, the financing, the funding, the workforce issues. These are kind of those upstream policy systems and environmental changes. And then the second strategy is around knowledge, attitudes, and behaviors, because we know that while we want to put a lot of focus in upstream, there are people right now needing help, needing services. And so both of those strategies are needed. Moving into outcomes, Alma kind of went over these earlier, but you kind of see our initiative level outcomes here. And then overall long-term population health outcome, we're really getting at improved quality of life. Our people's behavioral health issues kind of either lessening or manageable in a way that their quality of life has improved. So again, this is a 3-year framework, lofty goals, like we were talking about, but we will be evaluating kind of our progress toward these goals. Collaboration. So this is something that's been talked about a lot as well. We know that collaboration is key to our success. We also know that to achieve these kinds of lofty goals, it would not be possible for one organization to do this by itself. This is how we're thinking about collaboration. This is a common continuum that's used. From the left, you've got compete. All the way on the right, you've got integrate. And I love that they put compete up here. This is the Tamarack Institute, if anyone wants to look it up. I love that they put compete on here because it's true, right? We are often competing for either clients or resources, public attention. Moving to coexist, don't really partner or collaborate, we just happen to be in the same city, town. Communicating, this is your information sharing. Moving to cooperation, I think this is where a lot of organizations lie in their partnerships. As needed interaction, mostly positive on specific projects. And then coordination is where you're actually trying to align for those greater outcomes. And then moving to collaboration, so that longer term interaction based on shared mission, goals, shared decision makers, and resources. I would say most kind of collective impact initiatives would fall in this collaboration category. And then integration is kind of fully integrating, co-locating perhaps, based on shared mission, vision, and goals. And I do want to point out that integration is not necessarily the holy grail, right? This is a continuum just to start thinking about the different ways you can collaborate. And you might choose to stay in a coexist stage with some of the organizations. You might want to get to a collaborate stage with other organizations. And this is just a framework to think about collaboration. Gonna pause and do a quick exercise again. I would love to take about 2 minutes each, share with your person sitting next to you. Think about an organization that you partner with now and where you fall on this continuum and where you would like to be on this continuum. Is that clear? So think about an organization you partner with now, where you fall on this continuum and where you would like to be on this continuum. Ready to go. Hey, so who would like to share any thoughts about collaboration, where you are now and where you'd like to be? Yes.
I'll just yell it.
Do we have a mic?
I mean, I don't know whether you're open to this, and I'm just going to be frank about it, but
Please,
I'm always
And this was a collaboration from this.
Okay.
Yeah,
Yes, we have collaboration right here happening.
It's really hard for those of us in the nonprofit community to coordinate, collaborate, or integrate when resources are so scarce. And I applaud your approach, but the way you're laying out these grants at $100,000 each, you're incentivizing competition, not collaboration. And so ideally, theoretically, you guys could create a bundle, $500,000, something like that, to see if you could get broader collaboration with more resources. Mm-hmm. Just my 2 cents.
Thanks for your candor.
Can I add something?
Let me respond. No, definitely appreciate your honesty. And this is kind of our coming out. We're stepping out. So we need to start small and take steps. We don't really consider this starting small at $100,000. We felt that was a pretty good chunk of change based on the environmental scan that we did. So that's a response. I think there will be sort of openness to figuring out what the next steps look like after this 3-year initiative, and we certainly look forward to having that conversation. So there was another comment?
I just wanted to add on to what you were saying, because it's also, that really speaks to sustainability also, even though it's incredible that Cottage is doing this. It's very hard when you guys want expanded services, but you'll only get funding for a year, and there's no, there doesn't seem to be year 2 in the conversation, and it makes it very difficult for smaller nonprofits or any nonprofits to get a new program up and going and collaborated on, knowing that funding is going to end of the year, which is also before a lot of the outcomes have been realized, so that selling it to other potential funders would be very difficult.
Okay, so the comment is around sustainability. The RFP is only for 1 year. It makes it hard for smaller nonprofits to compete for the funding. I would like to address these kinds of questions, perhaps during the reception or maybe one-on-one. These are not uncommon, right? We've definitely heard this before. we've gone through a really great process to put our RFP together, and this is kind of our focus. We are collaborating with Santa Barbara Foundation, with other funders to understand sort of what are the funding needs around behavioral health. Is there anyone who wants to share their story around collaboration? Yes, in the back. I saw you first, and then Maria.
Well, I was going to just say that I think it's not mutually exclusive, because I am currently in a couple projects in a collaborative with others, and yeah, initially there, some people did get grants, some people didn't. That's true, but a lot of people did, and it has been. I mean, we have maximized resources. I mean, with all of us working together, and they're in this room, and then there was another thing. The smaller agencies, I'm thinking, I don't know that it would be so hard if you work with a bunch of people. If you're willing to do the work, a lot of us would want to work with you. So.
You have a
And
volunteer.
it's a lot of work at the very beginning, and then it smooths out.
Okay.
That's been my experience.
Thank you. Anyone else who kind of identified where they were on this continuum and where they might want to be? Yes, Deanna.
I want to speak to actually two collaborations, because one of them came out of the Cottage Health grants last year, and it was about collaboration on access to care. And the food bank in Williamson and Diabetes had applied for a similar grant, but they needed a partner for access to care. So the neighborhood clinics were that partner, and because we came together through that partnership, it actually opened funding for all of us for later years. And we were able to parlay that into a much bigger grant. So this, I think we have to look at it as seed funding a little bit, and how we can just get it started to get more money and more money and more money being fed into it. And just to just a tiny bit, because I have Sanctuary Center right next to us, the clinics are working really hard with Sanctuary Center on a fully integrated clinic that's about to be open in 2 weeks, where patients can have medical care, behavioral health care, dental care, all in one location. And it took a long time. It's been almost 2 years, and we've been, again, working for 2 years to find the right funders. But again, just a little bit of seed funding really, I think, helped to parlay that to success. So I know maybe it doesn't seem a lot, but if you think of it as the pilot seed funding, it could really help to bring some more dollars in.
Great examples. Thanks, Deanna. All right, we are going to move on. I just have a couple other things I wanted to impart. So through this application process, Alma already talked about the evaluation technical assistance. That's just kind of jargon for we will help you with evaluation. And these are the areas we can help you with, talking through your theory of change. We're going to ask you in the application to talk about your case statement. This is just who's benefiting from your services and how do you know? Developing outcomes indicators, determining those data sources, what are the right methods, and then what are the indicators for evaluating collaboration, because that can be pretty tricky too. And then we wanted to give you Alma's email address, so please feel free to email her directly. And this is how you could sign up for assistance. List the times you're available for a 30-minute phone call. And we are asking that you please include your program staff on the phone call. We won't be taking calls with just a grant writer or just a development director. We think it's really important for program staff to be integrated into those conversations. And the assistance is available June 28th through August 4th. The grant deadline is August 8th.